Thank you for the opportunity. I'm going to talk about non-compounded polidocanol 1% endovenous microfoam or thermal ablation, a network meta-analysis. And this is something that a group of us put together, and so I will show you my disclosures. And I'm very proud of working with this group to look at this meta-analysis and to come forward with it. So this is the paper, and if you want, there's a QR code and it'll take you right to the journal for the paper. Let's talk about it and how long it took us. It took us a long time, didn't it? Yeah. So anyway, the objective of the study was to compare the effectiveness and safety of the polidocanol 1% microfoam ablation versus radio frequency or laser energy in the treatment of adult patients with lower extremity truncal vein competence. The study design was a systematic review of the published comparative evidence, whether it was randomized or non-randomized, and incorporated into a network meta-analysis. What is a network meta-analysis? I had no idea when I started, but now I really do. And a network meta-analysis is pools and synthesis evidence from both direct and indirect comparisons. The primary effectiveness outcomes were closure rate, venous clinical severity score, VLU healing rate, and safety for secondary outcomes and patient-reported outcomes. So the methods for the network meta-analysis, we looked at conducting an outcome survey, sufficient data for polidocanol endovenous microfoam and endothermal ablation, which included the closure rate and DVT. Closure rate and DVT were summarized with odds ratio, the sensitivity tests, and estimates of network inconsistency using local and global approaches were employed to investigate the model robustness. So if we look at it, we looked at 2,000 studies published from 2000 to 2023. Only 13 studies met our eligibility criteria. 6 randomized trials and 7 non-randomized comparative studies. If we look at the results, PEM was not statistically different from endothermal ablation for vein closure. And I'm going to go back into this one a little bit more. So if we look at Verathena or PEM, it had a higher odds ratio for vein closure and was statistically significantly differentiated from physician compounded foam. Oh good, there's an arrow here. And you can really see from this forest plot how far off it was, and the odds ratio was almost 3. If we go on further, there is no evidence of that Verathena is associated with an increased risk of DVT compared to endovenous thermal ablation or physician compounded foam. And you can see from the forest plot that they all touch 1. With that being said, ladies and gentlemen, the conclusion very simply is that PEM was not statistically different from endothermal ablation for vein closure and DVT risk for chronic venous insufficiency treatment. Verathena was statistically significantly differentiated from physician compounded foam with a higher odds for vein closure based on a network meta-analysis of published evidence. For vein closure, a sensitivity analysis showed findings that were robust as standard follow-up for at least 12 months or even greater up to 6 years. So there will be a living meta-analysis, and that's something that's really important for us because it's just not a one-time and done. We're going to be looking at this on a quarterly basis, and I will be presenting the update later on today. So understand that there will always be, for the next several years, an update as opposed to a one and done. So thank you very much for allowing me to have the platform.